Health experts have expressed concern that Johannesburg's Hani Baragwanath Academic Hospital, one of the biggest in the world, may be unable to deal with an influx of diseases that will arise post-COVID-19. This after the hospital announced it planned to let go of 819 staff members. Workers staged a picket outside the hospital. You remember that was last week, Thursday. Let's speak now to the chairperson of the Medical Advisory Committee at Hani Baragwanath Hospital, and that is Professor Mampapatla Ramokgopa. Thank you very much for availing yourself this afternoon, Prof. We're taken back to the media briefing, or the briefing that the Department of Health in Gauteng, as well as the CEO of Hani Baragwanath, held on Friday. They had made mention that the people who held a picket on Thursday were not employed, or are not employed with the department, but they belong to a contractor. If you could please give us clarity on that issue before we proceed with the conversation.
Good afternoon, and thank you very much for affording us again this opportunity, to come and highlight the plight of Hani Baragwanath Hospital. And I guess perhaps the rest of the other public hospitals or health facilities in the country, countrywide. But for today, I would really want to focus more on Hani Baragwanath Hospital. To clarify the situation, the protest that took place on this past Thursday at Hani Baragwanath Hospital, it was a protest action that was organized from within the hospital by the clinical heads, of all the departments in the hospital, Hani Baragwanath Hospital, both medical and also related fraternal areas like nursing, pharmacy, rehabilitation, and so forth. So you had a combination of, all those categories of hospital workers. Now, at the center of the discussion, yes, it's about the 819, contracted COVID-19 appointees, who were brought, onto the hospital, at the height of the COVID-19 pandemic. That was sometime during the first and second wave. And this happened at the insistence, after the motivation by the Hani Baragwanath Hospital clinicians, when we foresaw that there was going to be a problem, as we've been seeing all over the world, that people were suffering, people were dying, in their numbers. Now, if that would have happened at a place like Hani Baragwanath Hospital, that sees so many patients every day in and out, this is a hospital that is one of the biggest in the world. It's got 2,888 beds. And every day we operate on lots of patients get seen and admitted here. So now we are very concerned because already we're dealing with a shortage of staff that has been lingering for years, which we carried right from the days of apartheid, which unfortunately our own democratic government, has not corrected. We always ran with chronic staff shortages. And when you look at this hospital, we ran at a deficit of about 900 or so staff members. And that is why often you find that you don't have cleaners, you don't have porters, you don't have enough nurses, you don't have enough doctors. Doctors and all other categories tend to overstretch themselves. And sometimes you find that some of the areas are not even attended. So this action, indeed, it was something that was organized and carried out by all of us that felt that, this situation needs to be corrected. These are bona fide Hani Baragwanath Hospital healthcare workers.
Prof, we were made to believe, or we have been told, let me put it like that, that there is a severe shortage in terms of budget to maintain these staff members. We also understand that some suppliers are owed some 4 billion rand. I mean, at the picket on Thursday that Malungelo Boy, Newzroom Afrika's reporter, was covering, some of the people who were picketing were telling of stories of how they had to take monies out of their pockets to buy patients food, but the CEO coming back to say, we just had a bread shortage, and that supplier also not paid, buying bread for patients from petty cash. As you mentioned, this is a chronic problem that has been in existence for a number of years. What do you perceive is at the heart of not wanting to fix this issue?
Yeah, as I said, we are carrying on with the legacy of our past. Where, hospitals or facilities such as Chris Hani Baragwanath Hospital were always treated as second grade. In other words, when the budgets and resources were allocated, we are always, thought about right there at the bottom, despite, the huge number of patients that we see, despite the fact that, we continue to give, quality care to our patients, despite the fact that, the patients that come here are patients that are from the local communities of Soweto and the surrounding, and also from beyond. As a specialist hospital, tertiary, quaternary, it also see a lot of primary health care patients that could be treated at other facilities. But unfortunately, because our healthcare system is not that strong, this hospital finds itself in a situation where all myriads of patients come here. But now, about this legacy that I'm saying that we carried, if you take a walk through Baragwanath Hospital, you see the dilapidation. You see the care of the hospital just outside, the grounds, that they are not well looked after. You go to the toilets, all this represents, what, how this hospital has been treated over the years. The same is transferred to what is given to the patients. In other words, our patients seem to be second grade. And we are saying as healthcare workers that we're not going to accept this. And of course, that treatment as second grade also relates, to the fact that we've always ran with shortages. We've been under budgeted, not just for staff, but also for consumables, equipment, and the general care of the hospital. So this is at the crux of it. Now, talking about the budget, we are not mindful of the fact that the resources are limited. We're also mindful of the fact that our economy has not been doing that well. But the one thing that we want to highlight is that just like anything else in our country, I think our priorities are misplaced. We don't have our priorities right. And the fact that as a new government, we're committed to reverse, the injustice of the past, we seem to have forgotten about that. And the more we turn a blind eye, to things like where you've got gross shortages, where the needs are there, but there are no requisite resource allocation. That is a problem. And we cannot, now and again go and spin doctor this thing and say there's no problem, when the people from inside are crying out and saying there's a problem. For us, we see these things day in and day out. We are right there at the coalface. So it is up to government, whether they choose to listen or they choose to spin doctor this, whilst, the electorate, other people that voted for us, are actually suffering. People are suffering. Some of them are voiceless. They don't know what to do. And sometimes the complaints are misplaced in the sense that the blame might be directed at the nurses, the doctors, or even the local management. But at the end of it, it is all about resources. Now we're making an appeal, that our government need to look at these resource allocations and make sure that our priorities, are, back to what it's supposed to be. It must talk to what this country needs for us to be able to drive, everything forward. We don't deserve this.
Prof, apologies, just for the purpose of time, you could be on an island somewhere enjoying the fruit of your labor. Here you are continuing to champion this cause, which you rightfully mention, inherited or not, is still not being fixed. Why do you care?
We care because we've got a conscience. And to tell you the honest fact, there are people that have been working in this hospital, in this environment. Some of them, got good quality professionals, of not just a national standing, but of international standing. And by the way, this hospital has produced such over many years. Nurses, doctors, OTs, physiotherapists of high standard, that have worked here. And some of them, chose that, they're not going to stomach this anymore. There was a lot of hope with new government that things will change. And some people have now given up. Now, we continue to work here because we've got a conscience. We realize that we can't all run away from problems. Some people have to stick around and ensure that we continue to battle. If we manage to battle against the old apartheid system that caused so much harm on our people, there's no reason why we should now give up. We should continue to strive until all our people get a fair dispensation. These things can be corrected. We just all need to put our heads together and be honest about what we have, the problem on the table, and deal with it, head on. This thing of ostrich mentality, trying to behave as if things are okay. We're taking advantage of the voiceless majority. We're taking advantage of those that do not have the means to come and stand here in front of you on News Africa and other good media and tell it as it is. We're taking advantage of people. And I think this is something that we need to now, make sure that it stops. It's time that, our government and the people of South Africa begin, to address, the real problems that we have and ensure that the budget goes where it's supposed to go to serve the people. This thing of money, lots of sums of money and so forth, tenders, money milk out of the system, and the people not getting what they want, it is something that government needs to bring to a stop. We're not going to pontificate. We're not trying to be populist at all. But what we say is that, can we get our priorities right? We feel that there's lots of money that is flowing in, but that money is not being used for the right purpose. And it's time that we wake up to that. COVID-19 was a serious wake-up call for all of us. And the fact that government brought in 819 extra manpower, it was a good proof that with that things can change around. Hence, we're able to defeat COVID-19 pandemic. Now that the crisis are abating, everyone in government say no, now continue with the crisis that is being happening. This state of emergency in healthcare, it is something that we need to pay attention to. And the country must wake up to that and put politicians under pressure that please put your priorities right.
Professor Mambabatla Ramokgopa is the chairperson of the Medical Advisory Committee at Chris Hani Baragwanath Academic Hospital. Thank you, sir, for availing yourself this afternoon.